Welcome back, folks. It's Dan Solloway, the host of the Health and Fitness Radio Show, and you're listening to News Talk 1520 KOKC. And I have Dr. Pai with me from New Mexico. He's a very extraordinary MD. He's been involved in some very interesting research with CBD, but in research in general in integrative medicine. So, Dr. Pai, thank you for being with us, and give us some background on you.
Well, thank you for inviting me again. My name is Dr. Pai. I'm an integrative medicine MD specialist here in Albuquerque, New Mexico. I've been practicing integrative medicine for 14 years. I've trained first and formally in one of the first classes of integrative physicians in the United States with Dr. Andrew Wall at the University of Arizona 14 years ago. I studied with Deepak Chopra, went to India, studied Ayurvedic medicine, came back, did my acupuncture through Stanford, did my nutrition through Cornell, and assist in publications in medical textbooks and journals, assist in clinical trials on natural therapies, and lecture across the country at conferences using natural therapies for treatment of chronic diseases and cancers.
Well, since you've been using the CBD, which we need to explain, just in case someone hadn't heard this, that CBD comes from hemp oil, but it is not. It's not marijuana. Doesn't have the THC. It has all the health benefits you probably have heard about on marijuana, without the negative effect of people getting stoned and getting fat.
Right. Yeah, I would say, it has the health benefits without the high. So it's something that, you keep your full faculties in focus, but it's a kind of a multi-system approach. There's a lot of research that will show the benefits from almost A to Z now. We're looking in so many varieties of aspects, not just in the brain, but also for the body, for neurological conditions to inflammatory conditions to pain, sleep, anxiety, other type of disorders, and we find that there's a balancing effect that people are lacking, and their own system has these receptors. So we're not taking a foreign substance. This is actually something that our body actually has receptors in our brain, our organ, our muscles, our connective tissue, and our glands, and we're just stimulating them to actually create more of a homeostatic response, or a response that maintains balance in the body.
Yeah, I understand it's actually very high in breast milk. That's one of the first things that helps getting the baby in balance and get them going, is this oil that is found in breast milk. But apparently after that, it's not easy for us to get. And it just happens that hemp has this, but it had a very low amount. And now they've bred it so it has a higher level. They've engineered the seed, has a higher level of the CBD. And it's been a real breakthrough in the medical community. I mean, I've heard doctors on YouTube and saying this is maybe the most important herb ever for health.
Yeah, from our standpoint, integratively, even looking at the cannabis plant, it goes back about 3,000 years, even the uses of a traditional Ayurvedic medicine in India. We use that plant. The thing is, over time, over thousands of years, they've kind of bred those plants to have higher THC here, say, for example, in the United States for the illegal high aspect. And we forgot the good part of the CBD that got lost over time. But now we have a complete new source, which is the brother of the cannabis plant, which is hemp, same family but different species, and it really has basically virtually traces to none of the THC and high levels of CBD. So you can get the health benefits that we have even used for 3,000 years in traditional Ayurvedic medicine, Chinese medicine, Tibetan medicine, as well as more recently in the last 5 years, all the research here in the U.S. and in Europe showing benefits in cancer patients and seizure patients and MS patients and colitis patients and otherwise.
Yeah, there's so many people suffering from all this inflammation throughout their body, really destroying their organs, their cells, their life. And so to have something that helps bring that inflammation under control and bring the body and bring the immune system under control so the body can do its normal regeneration effect and getting itself in balance and take care of the healing process. So some of the things that you use it for with your patients, what are these, Doc?
So, again, for most general patients, it helps with anxiety and insomnia. Those are the two big major things that we see just in the general office practice, because most people will have those kind of things due to the stress of their job, their workplace, and also through the economy right now. So that's one thing. But we also then can use it to treat chronic inflammatory diseases, autoimmune diseases, and then serious conditions such as cancer. The difference is the doses that we provide in different delivery systems, and that's something I would recommend to someone that has a serious condition to make sure that that you're being followed by a physician. But for other things like just insomnia or anxiety, since there's no side effects, and right now in the clinical studies they can go up to hundreds of milligrams with no side effects so
Oh,
far,
really?
even the prescription ones in Europe. We can just say people can start very slow and dose up as they feel needed.
So apparently, once the receptor sites are filled, it's not the body gets rid of what it doesn't need, and you can't fill it up any further. Is the way I sort of picture when you say you can take high
Well,
dosages.
since it's not a psychogenic component, there's no issues of stopping, say, your respiration or interacting with anything else negatively. I think, probably at the highest doses, people would feel more tired in a way, but that's just from a relaxation response rather than a depressive response. So far right now in our clinic, we haven't exceeded or come close to anything done in the clinical trial, because when we use the whole CBD product, then less is actually needed to produce a better response, in my opinion.
Okay. And again, we've said this on other shows, a little bit makes a person alert, and they could actually use it in the morning, and a little bit more helps a person get some of the best sleep they'd ever get. And I've been experimenting with myself. I always like to try something before I talk about it on the show. And I've been using Vigorest together with the CBD, and I have to say it's the best sleep. You really, really get a sweet sleep that you just, like this morning I told my exercise class I'd like to spend another hour in bed. It's very,
It's
very
like a
nice.
deep sleep, and just even from my training, as I think most people who work in the healthcare system with odd hours and being on call, you kind of lose your sensitivity to sleep, and so therefore you're very sensitive. And this is something that I can take that will help me sleep, but does not make me sleepy or affect my thinking if I have to get up instantly and go do something. So it's something that's really nice that makes me restore my sleep function without feeling drugged or hungover, say with a melatonin or a sleep aid.
Well, you're obviously, from interviewing you, and we've done a number of interviews, that you're one of the fastest talkers I know with clarity of thought, and yet, so it doesn't slow your thinking down.
No,
you're using
not for me at least. But it does, for example, with my patients who do take anti-anxiety medications, for example, then it's helpful for them, because we want people to, when we give a prescription drug, for example, for anxiety, it does help with the anxiety, but it also makes people not care about anything else. So say, for example, someone takes an anti-anxiety pill, although they're less anxious, their panic attack may be subdued, they also don't really care about putting in the mortgage payment this month, or maybe they pick up their kids a little bit late from school. It kind of makes everything just kind of static. And the nice thing about the CBD is it does create this relaxation response, but your full faculties are kept intact.
That's cool. Now, we're just about out of time here, Doc. I'll talk to you again in the near future, but we're talking about cannabidiol, a very important substance. You'll hear more and more about it. Thank you, Doc.
Thank you.